I'm Ruth Prudhomme. I was born in a farm in Kansas. Then later, my mother died when I was only 3 months old, and I had an older brother and sister, and we were taken by different relatives. So I was raised by several different relatives. The main family that I lived with moved to Lindsborg, Kansas, where there's a small college. I was raised in Lindsborg, graduated from high school there. These were Depression days, so it was a lot of working in homes, even though I was still in high school. I'd always, some way or another, I always aimed to be a nurse, and however, I was only 17 when I graduated from high school, and so I had to wait a year before I could go in nurses training. So during that year, I went to Minneapolis.
Hold on for a second. Well, we're going to just John here for a second. See, you're looking a little bit.
Oh.
Yeah, you can get a little closer here. I think it makes it look a little bit better on where.
Oh.
Now let's see. You just stopped at.
We'll go back to the fact you talked about you'd always wanted to be a nurse. Right?
Yeah, start there.
Always wanted to be a nurse, and however, when I graduated from high school, I was only 17, so I had a year before I could go in nurses training. I went to Minnesota, to Minneapolis, and worked in a home. I worked for a board and room and $1.50 a week, and I went to Bible school half days. However, these people were great people, and they later became what I regarded as my Cinderella parents, because they just gave me so much all my life. Then I entered nurses training at Emmanuel Hospital in Omaha, Nebraska. It was a institution that was led by deaconesses, and they were the chief nurses, the supervisors. It was a very, they were very concerned about weak students. After 4 months probation period, then we went on full 8-hour duty plus our classes. When we graduated from, it was a 3-year diploma program, and got our state registrations, and somehow in there, don't know just exactly how it happened, but they kind of classified us on a Red Cross reserve that was whether we would, if we went in the service, we'd like to be Army or Navy. They didn't make much issue of it, so we really weren't hardly aware of it until we started getting papers on it. In the meantime, I went back to Lindsborg and worked in the hospital there. It was a very good experiences. It was an old house that was converted into a hospital. We had a local surgeon who did a lot of work, and I was kept very busy. In the meantime, I'm getting letters from the Army that I want to do this and this and that. So finally I decided, well, let's see what it is. And all of a sudden I got orders to report to Jefferson Barracks, Missouri, just outside of St. Louis. We weren't sworn in till we got to the barrack, on duty there. As I took the train out from St. Louis to Jefferson Barracks, I saw another girl that looked like I felt. which was pretty forlorn. And I tapped her on the shoulder and said, "Are you by chance going into Jefferson Barracks as a nurse?" It was before the WACs were in. And she said, "Yes." That was Polly. And Polly was my friend from then on. She didn't go overseas with me, but we're still friends. Being my name was Peterson then, my nickname was Pete, and it was always Pete and Polly. Jefferson Barracks was sort of a induction place for nurses. We did work, but we're not real busy. However, Polly and I both worked on the isolation ward, which was not very sick patients, but they were servicemen who now had measles or chicken pox or something. The wards were had been barracks wards in World War I, had not been used since, so they were very dilapidated. And in the meantime, the termites had taken over, and so you'd walk along the floors and all of a sudden you'd cave in. The regular nurses' residence here was fully occupied, so we were housed in a great big old house overlooking the Mississippi River, about a mile from the main nurses' area. It was a home that had been, they said, had been built for General Grant. And it was quite a unique place. Had great big rooms and a marble fireplace in each room. And overlooking the Mississippi was a nice scene to see.
Was this a Civil War site then?
Yes, it was. We were told that it was the Civil War, that actually in the hospital that there was a tunnel that went from the south to the north. I didn't see it, but it was a great old post, and they had great retreat parades and things like that. It was a good induction to old Army life. We were there a month or so, a couple months, and then about 12 of us were transferred to the West Coast, to Vancouver, Washington. This was to Barnes General Hospital. It was a brand new hospital, barracks-type buildings with connecting ramps, and was a very, very busy place. There were all types of specialty wards, eye and psychiatric wards. We also had many, many surgical wards. And as things went on, I particularly remember the casualties that we got from the Aleutians. They were men that had been wounded and were put directly on ships, and then we got them from the ships. I particularly remember when I had a whole ward of frozen feet, besides the war wounds and grenade wounds and that. There were 2 black feet at the end of every bed. And they were black feet. And these men had had rubber boots and had gotten wet when they landed, and their feet froze in their boots. So besides the wounds, what were they going to do with these feet? We never saw the outcome of it because they were shipped on inland. But we treated them as best we could with heat lamps, and it was just, well, your guess is as good as mine. You do what you think you should to them. So it was mostly heat lamps that we used.
I'll interject one thing here because I don't think a lot of people understand that when we invaded the Aleutians, it was in the wintertime. And the conditions obviously in Alaska were pretty severe at that point. But do you know anything more about that, or?
Well, what I was told was that these men were equipped to go to tropical deals, areas, and then were sent to the Aleutians and way out on the Aleutians.
What was the time frame? What year are we talking about? 41, wasn't it?
I think it's 42 or 43.
Yes, it would be 40. It would be 42. Because I went in April of 41.
Okay.
Just off topic a little bit, I saw there was a History Channel had a show on. I was channel surfing one night, and it was about the Aleutians just about a week or so ago. And I watched a little bit of it, and it was, I think, 42, 43, a little overlap there, so possibly. So it was.
We also had patients from a lot of the bases around there, even St. Louis, Fort Lewis, Washington base, and then several other bases that were all on the West Coast, in Oregon and Washington there.
I was going to ask you one, or if you have other things, I'll come back and do it later. You got other points there, John.
Okay. About this time now, I think you told me you were on a 24-hour alert for overseas duty.
Yes.
Do you want to tell us, start out with this?
Well, first of all, before we got to that point, I really remember Pearl Harbor Day. It was on a Sunday. On Sundays, we worked half days. And so I was working the afternoon shift. And we were going in, and we had a little rec room in our barracks type building, and we were going back and forth from the rec room, and all of a sudden heard this announcement that Pearl Harbor had been bombed. And oh, wow. And of course, one of the first things Polly and I thought of was that our leaves were canceled, because we were supposed to go on leaves in a few weeks. And but from then on, things really changed. It was complete blackout, and full. We had to wear a uniform all the time if we left the base, and you couldn't even leave the base very much. And it was all different then. Soon after this, then I was put on orders with a group assigned to a station hospital. The rest of the unit was in Kentucky, and all we got was that be prepared to leave in 24 hours. And so for 13 months, that's all. We didn't hear any more. So we were on 24-hour alert for 13 months. So of course that meant that we couldn't have leaves or could hardly go anyplace. But it didn't make too much difference, because we were really kept busy at the hospital. And then it was towards the end of November in 43. I was on duty in my only nurse in the 30-bed ward, and they called me and said, "We got our overseas duty orders. We're supposed to be able to leave by morning." And I couldn't believe it, but okay. They said, "Well, we don't have anybody to relieve you, so will you stay on duty till 7? Well, no choice. And sure enough, we had our orders, and so it was a matter of getting rid of stuff and what do I take with me, and we left by train to go to Camp Stoneman, California, the next morning. So we were on the train all day, arrived there about 8:30 at night, and had to be ready to sail the next morning. The ship we went on was had been a nice liner, luxury liner. There were 16 nurses and 8,000 troops. So our we had the captain's deck, so we could look down and talk to these people, this group and this group, and we even got fruit for once in a while in our quarters, so we would take it up on the deck and throw it down to a favorite friend down there on the deck. We sailed independently, so it was a slow trip, 25 days to cross the ocean. We zigzagged, and of course it was complete blackouts at night, and not much to do except just visit with each other. We got into the Townsville, Australia harbor, which is way northern Australia. We got in there, and we're in the harbor for almost 3 days, but we couldn't leave the ship. However, the crew was a civilian crew, and they could leave the ship. And this is New Year's Eve day. They left the ship, they celebrated. They got back on the ship, and at 6 o'clock at night, this very inebriated crew, and they got orders to sail through the Coral Sea. Well, it sounded pretty bad. Fortunately, they were required to have an Australian pilot. So thanks to him, I guess God takes care of us. So we got through that night, but it was a hilarious night. The captain was so inebriated, and he was going down the halls, turning the fire extinguishers upside down and throwing dishes, and it was a rough night.
If you sail with an inebriated crew, does it make it easier to zigzag?
Tell us where you were headed and why.
Well, we didn't know where we were headed, but it turned out to be Milne Bay, which is down in the very end of New Guinea. There we went to a kind of a nurse's staging area. It was the quarters were thatched huts with walls just a couple feet up and a roof. We were told the area had been a palm olive peat coconut grove. They did take the coconuts out of the trees for us, but it was pretty crude circumstances, and we were about 6 or 8 of us in the hut the size of a pyramidal tent. But anyway, we got along, and we went to work at a local hospital. I was on a orthopedic ward. It was here again. It was a thatched hut or a thatched building. We were told that, and it was quite evident, that the native women made the thatch roof pieces back in the villages, and then the men worked to build the huts. We were told they were given nails and had just lots of fun pounding all those nails in one spot. They were used to just taking a machete and hacking out the logs to fit, and they did that much better than
Are you now getting exposed to the war experience? Are there military casualties that you're looking after? And what is your relationship to the war at this point?
There's I don't remember that there were too many casualties. Actually, we didn't think of our wards as casualty wards and other wards, because there were other surgical problems, fractures and cuts and injuries. There were lots of medical wards, because medical diseases were very prominent. I mean, and it was as frustrating to end up with a fever or dysentery disease as it was to be wounded. And so I remember more just as a general surgical ward at this time.
Your patients were GIs, though, weren't they?
Oh yes,
And-
all our patients were servicemen, enlisted men at this, or well, it could be officers too, but.
At about this point, didn't you tell me something about a lot of casualties from the Coral Sea problems?
We didn't have too many from the Coral Sea then, no. We went on, we were there for a while, and see, this is all not with our unit. And so after a few weeks there at Milne Bay, a month or 6 weeks, I guess it was, we were reassigned to a field hospital. And the field hospital was further up the coast at Finchhaven, which was a large base. However, our hospital was in the remote area of the base. And our hospital was all set up and had been staffed by the enlisted men for several weeks then. There we got not too many casualties even then, because we're more out. A field hospital was kind of out in a remote area to service the supportive units. However, we had a great combination. We also had there was a ward of Jap prisoners there, and we also had refugees. However, the nurses, we had so few nurses. We were only 16 nurses and that included 3 nurses that were in surgery and our head nurse. So it didn't leave very many nurses for the wards. So we were real busy. And so they didn't have enough nurses to take care of the refugees and the prisoners. So enlisted men took care of those wards. We were at Finchhaven for several months, and while there, we're in a remote area. We're not close to headquarters activities at all. I do remember. I remember when we did get to the Irving Berlin show. I don't think I told you this before. We got to the Irving Berlin show, and there was 6 nurses sitting on the front row, and all these enlisted men, troops. And Irving Berlin came out on the stage, and I guess it was to introduce the song Dancing Cheek to Cheek. And of course, this was, as nurses, we were now wearing long pants and long sleeve shirts rather than short sleeve uniforms or white uniforms. And Irving Berlin came out on the stage and looked down at us and said, You're the only ones that can dance cheek to cheek and pants to pants.
Let me take you back just a second to the treatment at this location of the Japanese captured and the local refugees. You were saying that just the enlisted men took care of them? Could you give us a little bit of that story? Where were they?
Well, they had a separate tent ward over there, and of course, actually, these were not acutely ill patients at all. They were mostly undernourished, and it was a matter of just providing food and maybe taking care of a few minor cuts or something, but it was not anything that required any intense nursing.
And who did that? Who worked?
The enlisted men do it. I mean, our enlisted men were just so well qualified. I mean, they did a great job, and they had done a lot of nursing before we even got there, so it wasn't all new to them.
These were trained medics, weren't they? Or were they just general soldiers, or were they trained medics, these enlisted men?
Well, by this time they're trained medics. They weren't, because our unit, we were replacement nurses for the 1st Field Hospital, and they had been in Australia a year or so before that. So they had already been overseas a long time. So it was a matter of working with with them as far as nursing was concerned. Now, it wasn't with 1st Field there, but it was at another hospital. I remember having so many medical patients, and these were dysenteries and fevers. And there was a dengue fever condition that they would get over it, but they felt lousy and would be dehydrated. And I can remember then that the ward man, we gave intravenousous to all the patients in the ward. So when they went to try to eat breakfast, we set up the IVs. Well, fortunately, they all, each bed had a mosquito net. So there was a bar to hold the mosquito net. And that made a very good place to hang the IV container. So we'd get all these IVs set up, and when they came back from breakfast, why, we'd start, the ward man would start at one end of the ward, and I'd start at the other end and start the IVs. You'd get them all started, why, it'd be about time to discontinue them.
Ruth,
And
you told me in this context and later on in your military career that the corpsmen or medics were tremendous help. Do you want to explore that a little bit? Start out with corpsmen. Tell us who they are and what they do.
corpsmen were the non-commissioned personnel, ranging from privates to sergeants, that worked in the wards. There was always a one corpsman that was head over the other corpsman, but the nurse would be over him. And I mean, if you were lucky, you had more than him. But sometimes it was only the two of you. And it wasn't a matter of them working for us or you giving orders to them. You worked with them, and they were so congenial and so appreciative and just so willing to do everything that they could. And good-natured. Everybody was in the same circumstances, so I don't remember a lot of complaining, regardless of whether it was nurses or doctors or even patients were just so appreciative of anything that you did, that it was just most satisfying. That was pay in itself. And the doctors, the officer personnel were very common. It wasn't a matter of, well, the captain's here now, attention, or anything like that. It was just a nice, friendly atmosphere, all working for the welfare of the patients.
I want to ask one thing before we
Please,
get out of this
please.
area here. Just to clarify a little bit, this hospital that you're at this point, is this a field hospital that's close to the front, or is this a place in the rear? Would patients or would the wounded be stabilized in the field and then brought to you, or would they get surgery somewhere closer to the front and then come back to your place for rehab?
Field hospital is a little bit misleading, probably. Actually, field hospitals in the Pacific were kind of a small hospital that was out away from the main part of the base, servicing maybe engineer groups or signal corps groups or other supportive groups. It was not necessarily in an immediate combat area. There could be some combat in that there was a lot of sniper activity, but it was not really, it was a field hospital in this regard was kind of out to service smaller supportive groups, units. Does that answer?
You talk about sniper activity. Was that sniper activity close to your area, or was it in other parts that they would bring patients?
Mostly other parts. Actually, when it was in our area, it was not really a sniper thing. Every once in a while, there would be a Japanese that was trying to break into the food supply tent or something like that. But it was a matter of getting food or something like that.
Just about this time, you were telling me about sort of a naughty party that you went to. You want to tell us start out with this naughty party?
Oh, well, it was a good party. It was a great party. By this time, things are moving on, and it's getting, the Japanese are being repelled more, and the hospital's going to move. Our first field hospital was moving on. And when they moved on, it was just the men that moved. We didn't necessarily move right with them. These enlisted men had been overseas for 3 years, and were sort of looking forward to going home rather than to going on further. And they got orders to go forward. We had been, by this time, we had lots of good friends in the enlisted men. We'd worked together for a long time now. And it just happened that their enlisted men's club was was on the river front, and we were on the coast front, ocean front. So the waves made a lot of noise, and you couldn't hear what was going on a lot. It just happened that the enlisted men had a band that night. And it just happened that they had gone, some of them had gone down to the Australian camp and gotten some liquor. And it just happened that the sergeant of the guard and the chaplain came along and took some of, we nurses, because we couldn't go anyplace unless we were escorted. We couldn't go outside our area. But they just happened to come along, and we wandered down to the enlisted men's club. And wow, we had a great dance down there. It was great. It went on for quite a while. There were, I think there were about 6 of us nurses down there. And we just had a great time. About that time, the adjutant and the commanding officer appeared. And by this time, some of the enlisted men weren't feeling any pain either. And he went up to them, this corporal went up to him and said, "You know, Colonel, I don't think you belong down here." Well, they didn't even venture to break it up. It was hopeless. But the next day, when our chief nurse gave us our orders, she said, "Any of you that attended the enlisted men's dance, report to the colonel." So we reported to the colonel, and we got a nice little statement that was an official restriction because we went to an enlisted men's dance. I still have that, and it's a nice memento.
I'm sorry.
No.
You, about now, you told me you were scheduled for some R&R in Australia, which was canceled, and they sent you to the 76th evac hospital on Lady Island. Do you want to get us into that story?
Okay, it's not quite the, well, we did.
I'm sorry.
Okay,
if I'm
that's right.
getting out of order, you do.
Well, we were, after we left, after First Field moved on, we were sent to another hospital temporary. And then they decided that we should hurry up and go on leave. So they sent, I think it was 4 of us, on leave to Australia. However, we had to get our own transportation, which was to go out to the airstrip and ask a pilot if we could get on his plane. Well, we finally got on, and we finally got to Australia. We had a couple stops in Brisbane, and then we got to Sydney, Australia, where we were to report for our leaves. And
If you need to take a drink of water, go ahead and do that. It's a good time to.
we got to Australia and went to sign in for our leaves. And they said, "Oh, first field nurses, don't sign in, your leaves are canceled." So our leaves were canceled, go back by first available transportation. The only scheduled transportation was a hospital ship personnel that were going back. It was not the hospital ship, but they were taking nurses back or forwards, and they were a group that had been in Australia a long time and weren't very happy to be going into New Guinea. But anyway, we went back, but we missed our unit. We didn't make connections with them before they moved on. So once again, we're lost, and we end up on Biak Island, which is just off of New Guinea, and went on duty again with the hospital there. It was a coral island. By this time, it is not in a combat area. We were on duty there for several weeks. Nothing very exciting there. Lots of water everywhere, but none to use. And in fact, we didn't have water for showers or washing our hair. Washing our hair was a real problem. So when we worked split hours, when we were off from, say, 10 to 2, we would go down to the waterfront, and when the tide was out, there was a spring there, and we'd wash our hair down there at the spring. It was better than once in a while. And now one time one of the girls was going to wash her hair when it rained, and we tilted up the tent flaps and poured the water in her hair. However, the tent had been tarred and her head got full of tar. So then we finally then did catch up with our unit. The unit had gone in with invasion troops on the to Lady Island when MacArthur when I still have quite a bit.
Let's take a second and clear your throat. Now, you're gonna be in Lady Island now, and you're gonna start seeing some casualties in this area.
Yes.
And your hospital is actually in a church, you told me?
Yes.
Okay, so,
I stopped here because I wasn't sure how long we were going to be down.
okay.
Okay.
Okay?
Yeah.
So we finally caught up with our unit on Leyte Island. Here again, they were our nurses were on detached service with the 36th Evacuation Hospital. They were set up in this Catholic church. They had the patients were all over in the church on cots, low cots. The baptismal fonts had been moved to the entrance of the church, and they were used for scrub sinks, and that was surgery. They were still having mass around the altar in Latin, so it was a little rough on patients that were completely confined to bed patients. These were casualties. Actually, our nurses that had been there had been right in on the casualty care. Being we were so late in getting there, we didn't get in on too much of the care there, but because we were very soon joined our own unit, which was across the island, was again set up as First Field Hospital. And there we did have casualties. The wounds that the men that had kind of dragged in the dirt in the fields, and their wounds had been exposed to the dirt, the soil was so polluted that they developed gas bacillus infections, which were very virulent, and a lot of them were amputations if possible. If not, if they weren't low enough, like if they were in the upper part of the hip or something, and could not be helped by amputation, those wounds were just split open and drained. And there's very definite characteristics of gas bacillus infection. It's just like your tissues get just like crunchy tissue paper. You touch them any place and it's just, you can feel it. If you've ever felt it, you never forget it. And it's a very rapid growing thing. So it's just, and there wasn't any medication that would take care of it. So it was just a matter of trying to irrigate them and clean up the wounds, and I had lots of those wounds on my ward then. Lots of amputations. The amputations were what they termed guillotine. They just left them wide open so that they could drain. It wasn't a matter of making a neat flap over or anything like that. It was left wide open to drain. So there was a lot of drainage. We needed a lot of linen, bed linen, which was difficult to get. I remember, and we were short of personnel. I can remember going over to the tent ward when the laundry ward tent, that when the laundry came back in a big bundle and you pulled out the sheets to try to get a clean sheet for a patient. When you put it on the bed, you tucked as little in as possible so you could have a little bit surplus to bring across to get a clean spot on it. Here again, drinking water was at a premium. Sometimes we had to give our medications by that horrible Australian grapefruit juice, which makes even the thought of it makes your mouth sour.
Would you continue the story by reminding us of where you are now and the approximate date? I think you told me it was 44 to 45, and you were at Carrie Gary.
Carrie Gary. It's a remote village. I mean, we didn't really get in the village, but the area was Carrie Gary. It was just out nowhere. Across the island, actually, when we went across the island in a truck, the mud was clear up to the hubcaps of the top of the wheels almost of the GI trucks. And the villagers had not seen white women like us, and they all came out to see what we looked like. However, when we got to our hospital, we did have, eventually then we did have Filipino girls that came in the hospital and helped us. And they were very, very cheerful, and although we had trouble understanding each other, we still got along just fine, and they were just real helpful.
Can you tell us what time of the year and what year?
Oh, it was.
And can you also tell us, if you know, where most of these casualties were coming from? A particular battle or island or something?
Oh, these casualties were just coming from more or less the cleanup areas in nearby spots. Here again, there's the Japanese don't have very dominating effect here now. They're much more the minority now. And so the casualties are pretty much by snipers in the area.
And when was this?
This was in December of 44. And we had Christmas at this, in this situation too. The Filipino girls took palms and made little birds and ornaments and hung them on the tent strings. And the chaplain had some Christmas music that he played on the loudspeakers, and we had good rations that day too. We didn't have the usual GI food.
Wasn't this the incident when you told me there was really one happy day?
Oh, yes.
Is this the day?
Pardon?
Is this the time you're talking about?
Well,
is this the happy day you were telling me about?
Yeah, it was a great day. It was a great day, and everybody was things were going well as far as the war was concerned, and we were back with our own unit. That meant a lot, and everybody was just bubbling over, and in fact, we didn't have any mail. We didn't get any mail. And we didn't have any Christmas presents, but it was still Christmas. And the Red Cross workers had given, we had 2 Red Cross workers assigned to our unit, and they gave each one of us nurses a pair of men's pajamas for a Christmas present. And we even had our pictures taken in that. it was a great day. Soon, let's see. Oh, I can't.
Yeah.
Okay, that was a Christmas of '45, and the VJ now is
25,
coming up
yeah.
in August, about 7 or 8 months
Yeah.
later. Do you have any experiences between
Well,
this
let's
period
see.
of time?
Oh, yes. So we were with First Field there for a while after Christmas yet, not too long. And then once again, we were, the hospital was, by that time they're getting sent home somewhat. So we're reassigned to 76th Station Hospital, which is back on the Tacloban Lady, the other side of the island. It's a station hospital set up right on the beach. Here again, it's tent wards, of course. It was pretty much a hospital for general care, surgical, medical, lots of medical there. The patients were not the immediate casualties by this time. They're more the recuperating. And a lot of these people were to go back to the States, but there was no transportation to get them back yet. And so that's why they're held up in the hospitals more. It was, I remember that it was difficult for the patients on crutches because of the sand. It's difficult to walk with crutches in sand, and that was a problem. But things went along real well here, and this is where we were when the Japanese surrendered, and I'll never forget that night. That was a real fun thing. We were in quarters, and if you were in quarters, why, you were pretty much ready for bed, nothing else to do, and the only telephone that was hanging out on the tree rang, and somebody said, "The Japanese have surrendered." And wow, the noise started, and the lights in the harbor went on, and we all got dressed and went on out, and everybody's kissing and hugging everybody else, and see all these flares going up from the ships, and about that time, this little nurse that I was with, the sergeant came along and picked her up and kissed her and whirled her around and set her down, and she came face to face with the commanding officer. And she said, well, Colonel, I'm so happy I could even kiss you. So everybody was happy, and from then on, there was just a different, we no longer had to be so cagey about blackouts and all that. And so we were with that hospital then for a while. But that night, the Japanese surrendered was, I'll never forget that scene in the harbor, because all the ships must have had fireworks to display, because the whole harbor was lit up for hours. It was great. So then everybody was eligible to go back to the States, but we couldn't all get back right away. So once again, our hospital, the First Field, was sent to Zamboanga in southern Mindanao. Zamboanga had been a very strong Japanese place, and had been a nice city, and it was just so bombed by the Americans that the buildings were, there wasn't a building that had more than one piece of a wall, and it had been a very ornate city, lots of statues, and they were all blown to pieces or ruined. It was our hospital there was set up in an old high school, comparable to about a 1925 hospital or 1925 school in the United States. I had my ward was what had been the auditorium, and so there was cot beds and a stage where which we also put to good use, and not for entertainment, but to put a patient that was convulsing, and anytime he started twitching a little bit, why somebody would see him if he was up on the stage, so would quick like be able to sedate him again.
You're about ready to go home now, aren't you? Pretty quick?
Yeah, we're ready to go home, but so is everybody else. And you want another amusing incident?
Sure.
We have less than 5 minutes, so we need to wrap this up here.
Oh, well,
You
we
got
better
5
skip
minutes
it.
left. Give us a quick amusement.
Well, I was doing surgical dressings on this ward, and all the patients were looking to see how many stitches this guy had. I took the dressing off, turned to get my forceps and scissors, and just then a little bird flew over and plunk, right a fraction from the incision. It was all quiet, and suddenly a guy said, "Almost a direct hit."
Well, you finally get home.
So then from there, from Zamboanga, I don't remember the details of how we got back, but we went back on to Leyte Island and then went home by ship. It didn't take us long to go back.
I asked you at the time if you had any thoughts about your service experience, and you told me a couple of things. One, that you felt very fortunate to serve, and how much help the medics were to you. Do you want to comment on any of that?
I really value the experience I had in the service, both from a nursing point of view, as far as the variety of experiences I had. I certainly value the friends that I knew, the people that I got to know, that both, particularly as far as the enlisted men were concerned, they were so congenial, they were so appreciative, they worked with you. There was not a matter of, well, I don't want to do this. It was a very positive attitude. We were all in the same boat as far as circumstances were concerned, and they didn't pity themselves, and we all just made the situation a good situation, and it was great, and I look back on it as a real good time of my life.
Wonderful. How's that, Eric?
Yeah, I've got one quick question here as far as, you kind of alluded to this one particular infection that was hard to treat. When patients were coming in with whatever disease, dysentery, malaria, anything like that, were you able to treat most of them effectively? Were the medicines good enough, and was the treatment good enough to save most people?
The medicines were not, we didn't have precise medicines as much as are available now. They were given a supportive treatment. It didn't really cure them, but it tided them over. Many of those patients probably would have those, a mild, a mild condition of this type for maybe the rest of their life. Actually, the tropical diseases were very devastating. We didn't have a lot of casualties from them, but they were very debilitating.
Okay, that's good. I just wanted to kind of get that point cleared up.
Could I ask one question?
Yeah, we have about a minute.
So we've got 1 minute. Could you reflect, we talked a little bit about the medical treatment available for the enemy that we captured and for the refugees. Would you comment, I know there wasn't enough help, but did we make an effort to treat them
Oh, yes.
humanely? Tell us just very briefly about that.
Actually, the prisoner of war, they were treated the enlisted men took good care of them. I mean, the patients that we had actually were more undernourished, and so they got good food. I mean, they got the food that we got. I think they did. I mean, because I know they responded very soon after they had been patients there. They were much better. And now down in Zamboanga, we had one of the classrooms in this. One of the rooms in this school was the Japanese prisoner ward, and they kind of took care of each other there too. And the enlisted men were in charge of their ward. The refugees were the same. They were mostly responded to food and drink.